Good evening, everybody. Welcome to HEALTHline. I am Gregory and Susanne.
And I'm Suzanne Watley. Hello.
How are you? How was your week? Hope you had a great week. Tonight, we are talking... Did I take it right out of your mouth? I did. Tonight, we are talking about home health care. And when you think of home health care, what do you think of? Do you think of...
Mom or dad or grandma or grandpa.
Or we used to call them Oma and Opa.
Taking care of you when you're sick, bringing you your chicken soup and your saltine crackers and putting the cold rag on your head.
Or putting Vicks on my chest.
But, you know, it's a very sophisticated field, home health care, and many times you have to leave it up to the professionals. In my case, Gregory, as you know, I don't have a spouse. I'm a widow with 2 little girls, and I don't want to burden them if I were in a car accident or somehow I was otherwise incapacitated. So I got long-term care insurance, and I'm planning on hiring a professional if I ever do need home health care.
But I would take care of you if you needed something. So if you needed soup or if you needed Vicks, I would take care of you. That's how I roll. Okay, so you found out now what home health care is. It's basically going out there and getting the help of professionals when you can't do it yourself. So joining us tonight are 3 very talented women in regards to this topic. First, right across from me is the director of home health care, Wende Brookshire, from Adventist Health, from Glendale Adventist Medical Center. Great.
Yes.
Perfect. Sitting next to her is Zita Manares. She is the manager of personal home health care at Glendale Adventist Medical Center. And sitting next to them is Diane Brown, registered nurse superstar at Glendale Adventist Medical Center. Hi, ladies.
Hello.
And you all save lives. I love that.
So let's start by talking about what Adventist Health Home Care does for people in their homes when they can't take care of themselves.
Okay, what we do at Adventist Health Home Care Services, we need a physician's order, and we primarily will deal with nursing care, where we can teach patients on how to manage their medications, to know when to take it, when to call the doctor, how to better manage their disease, whether it can be heart issues or high blood pressure, if they have wounds that need special treatment. We work with the doctor in getting the right treatment, so we go to their homes based on how often the patient needs it, to change dressings, to manage the medications, to give them injections, whatever the treatment is needed for that particular patient.
So the doctor will give you a prescription as to this is what you need. You then have a nurse, per se, like Diane, that goes to the house that will then walk the family through protocol of medications and treatments and stuff like that.
Correct.
Fantastic. And you know, we're going to talk to you in 2 seconds, Zita. So, home health care, we have just touched the surface of it. Don't go away, because we're going to find out exactly what Diane does in one given workday. More to come when we come back. Hi, are you a member of Facebook? You know, I am, because I like to know all that my friends and family are doing. Wait, did you know that HEALTHline has its very own Facebook page? All you got to do is go to Facebook, type in HEALTHline, find us, click like, and become part of the conversation about health, lifestyle, and the community. We post links, health tips, suggestions from you, the community, about what you do to lose weight, de-stress, have a happy, healthy lifestyle. Okay, once again, all you gotta do is go to Facebook, type in HEALTHline, and become part of the conversation. Hold on. Okay, somebody just posted that if you drink an 8-ounce glass of warm water with lemon, it starts to invigorate your metabolism, along with jumping up and down for 60 seconds first thing in the morning. Okay, you know what? I've got to pass this on. Become part of the HEALTHline conversation. We will see you on Facebook.
As a new nurse, Glendale Adventist helps me meet my patients' needs with compassion and confidence. I feel called to care.
As part of a highly skilled team, I'm counted on to save lives and make a critical difference to my patients and their families every day. I feel called to care.
I've been a nurse here for more than 20 years and have been given the chance to learn and grow. I'm doing what I love and love what I do. The opportunities at Glendale Adventist are endless. I am called to care.
Here on HEALTHline, we are talking about getting the care that you might need in the home. If you have, an accident, or maybe you're elderly, maybe your spouse is elderly, and you need a little break from taking care of your spouse, or perhaps someone in your family is just bringing home a newborn baby and it's a little bit overwhelming. You might just need someone to give you some in-home care. Well, Adventist Health Home Care Services provides a variety of different services, including the nursing care and the personal care, such as the cooking or the cleaning or the bathing or doing your fingernails, that kind of thing. And we have Wende Brookshire, who is the director of the Adventist Health Home Care Services, and the personal care division manager is Zita Manares, and one of the nurses is also here on HEALTHline with us tonight, Diane Brown, registered nurse. Thanks.
That was so good, Suzanne.
Being here.
It's so great to see you do all that in one big fell swoop.
I did it in more than one breath.
Did you?
Let's talk a little bit about the division of personal care, which you're in charge of, Zita, and then the RNs that go to the home too. Wende, you talked a little bit about that in our first segment. Zita, tell us about the personal care.
Okay, personal care division is we provide more for like ADLs, activities of daily living, like bathing, dressing.
So ADL means activity of daily living. Okay.
Yeah. So we help the family, we help out the patient. You know, that also includes light housekeeping. You know, in the house, we help the patient with daily exercises, whatever is recommended. We take them for walks. We do meal preparation to make sure, you know, that they have a good diet. And basically more of a companion. If the patient lives alone and they don't have anybody and the family is away.
So then do you take care of mostly elderly people or?
Not necessarily. It can vary. It
so
depends.
People that are sick or recovering and stuff like, do you, as you were saying earlier, Wende, you get basically the prescription from the doctor. Do you need the same thing from a doctor?
No, you do not need a physician's order. Basically, you know, it's a choice between the family. Do you need like help? If you need help at home, and if you decide that you know you are burdened, you know that you cannot do it because you're working, and the family member is needing more assistance, so they can stay at home and not go to any facility. Then the choice is, you know, the family member or the patient.
To bring in someone to take care of the family member. If I was working and my grandma needed the help that I couldn't do because I was working, we would then reach out to you at Adventist Health and make that happen.
And frequently we take care of family members who the children are adults and they might be living in different states.
Okay.
So they don't know who can take care of their mother or their grandparents. So they talk with Zita, and Zita matches up the caregiver to take care of that family member in absence from the children not being available.
Correct.
So they feel very secure that they have found a good agency that will provide great service based on what the patient needs, whether it's a few hours a day or 24 hours a day.
So go ahead.
Let's talk about what you do, Diane. When you go to visit a home, what would be a typical day in your normal work routine?
Okay, well, it depends on the diagnosis of the patient. So, like to say that if the patient's a diabetic, what the RN or the LVN would do would go in and teach diabetic care, teach them about diet, how to check their blood sugar, insulin administration if they have insulin, different medications for diabetes. But then we also have many different diagnoses, like people after surgery, like open heart surgery. So we teach them about you know, care after surgery, incision care, signs of infection to look for.
You basically walk them through what they need to know.
We walk them through what would they know, and a lot of it's medication, a lot of medication instruction, because there's a lot of questions.
Oh, it can be so complicated.
Yeah, definitely. And then we do IV care at home if the patient needs IVs at home.
And you also walk the family members through it as well, right?
We do.
Will you hold on to that cliffhanger?
Sure.
Okay, so if you have someone at home that doesn't know exactly what to do with their IV or their medication, you have landed in the right spot. We're talking about home health care and more with our three talented experts when we come back. Do not go away.